Any guy who has issues getting or maintaining an erection and is looking for a reliable, permanent solution to restore their erection is a candidate for a penile implant. Obviously, we've got to think about things like risk for surgery, how to improve that, how to decrease risks of infections and things like that. But overall, any man who wants to restore his erection permanently is a candidate for a penile implant. Your job is to take care of yourself preoperatively and to recover postoperatively. Our job is to figure out insurance coverage for it. That being said, it is a Medicare covered benefit currently, as well as some private payers do pay for this surgery as well. If insurance does not cover it, there is a cash pay penile implant cost. Currently in the United States, there's two types of penile implants. The most common is an inflatable penile implant, which is called a 3-piece penile implant, and there's a malleable or semi-rigid penile implant. A malleable or semi-rigid penile implant is a permanently rigid penile implant. When you want to use it, you basically bend it up. When you're done using it, you bend it down. An inflatable penile implant has two cylinders that go into the penis, a pump that's in the scrotum, and a reservoir that goes over the pubic bone. They're all internal inside your body, but it allows the fluid to go between those different areas. Penile implants are sized to you. What that means is that during your operation, we measure the length of the penis both in and out of your body and put in an implant that's sized to you. It also means that we give you the maximum length that we can possibly give you, and for an inflatable implant, it expands to the girth that your body will allow. For an inflatable penile implant, there's a pump in the scrotum that has two parts to it. It has a bulb part of it that basically pushes fluid into the two cylinders that are in the penis, and there's a little deflation valve to it. And that deflation valve, when you're done using it, you push on that and it will take fluid from the two cylinders and put it back into the reservoir. This allows men to have full control over their erection, so they can get an erection whenever they want to within 10 or 20 pumps, and it stays there for as long as they want it to, and then they deflate it when they want to, and it'll be deflated in a matter of seconds. Ejaculation and sensation are the same with the penile implant as before with your normal good erections. A lot of guys notice that because they're able to get a more reliable erection, that they are able to ejaculate easier and have better sensation because they're able to get a reliable erection. The only patients who have difficulty with ejaculation are patients who've had a prostatectomy or some sort of procedure that affects the ability for them to ejaculate. In those scenarios, the implant helps with orgasm, but it doesn't obviously help with ejaculation. An inflatable implant is fully concealed inside your body, so if you were at the gym changing in the shower, taking a shower, no guy would be able to tell whether you've had an implant or not. The only people who know are you and your partner, and obviously me, the person doing your surgery, that you've had a penile implant placed. The ability for you to conceal it is one of the reasons that guys like it the most. The inflatable penile implant is made of a BioFlex plastic material, which is able to be coated with antibiotics. As you can see, it's got two cylinders here that go into the penis itself. All this is the BioFlex material, including the pump that's in the scrotum and the little reservoir that goes up over your pubic bone. The implant is a self-contained system. What that means is that fluid goes from the reservoir into the cylinders to give you an erection, and then when you deflate it, it goes from the cylinders back into the reservoir. That fluid that's inside is just normal saline, salt and water. During your surgery, we put two cylinders inside the penis itself. That gets connected to a pump that gets put in the scrotum between the two testicles. That gets connected to a reservoir which goes over the pubic bone, back by your bladder. All those get connected and then enclosed underneath the skin. It's an outpatient surgery. What that means is you go home the same day. The recovery for most men is they're pretty sore down there. It's a sensitive area of the body for the first week or two, and then they kind of turn the corner. You'll have a catheter in overnight and a little wrap around everything. The catheter comes out the next day and the wrap comes off the next morning. Most men can use their implant at about 4 to 6 weeks after their surgery. The reason men and their partners like the penile implant so much is that with one surgery, they can have lasting erections that can go for 10 or 15 or 20 years, meaning they don't need to take a medication or do anything from that standpoint. The majority of devices are going to last 10, 15, or even 20 years or more. The satisfaction rate for men who undergo surgery is higher than any other option. It's greater than 98 or 99% for the patient and their partners. The risks of undergoing a penile implant surgery are very low, but not zero. The thing we obviously worry about is anesthesia and the ability for you to tolerate anesthesia, but for most patients, they can tolerate anesthesia just fine. The actual risks of the penile implant are: 1, at some point the device is going to stop working. Most devices are going to make it, like we talked about, 10 to 15 or even 20 years. The other thing that we worry about is getting an infection. We take every precaution possible to prevent getting an infection, including coating the device in antibiotics, giving you IV antibiotics before your surgery, and sending you home on antibiotics, all to prevent getting an infection. Bruising, swelling, things like that are much more unlikely to be major consequences of the surgery, and other unseen events are very, very uncommon.